This area has been underemployed, undereducated, underserved medically, and therefore underperforming on almost any list you wish to examine. Now that's the picture that was painted when, at my request, Dr. Les Johnson, LSU Dean of Rural Initiatives and Chief of Surgery at University of Health Conway, and myself met with Dr. Sizer in his office probably about 3 months after he came on board. We requested and received a 30-minute time slot, as I recall, Dr. Sizer, to discuss my district. 3 hours later, we were still talking. As a result of this initial meeting, we agreed to work with all partners we could identify in this rural area to see how this agency and staff could at least address the medically underserved part of the puzzle. The key to whatever success we might have was Dr. Sizer's willingness to come to the people in their home locations, not to have them have to necessarily come into his office sitting in Monroe. Subsequently, there were town hall meetings in Oak Grove, located in West Carroll Parish, Lake Providence in East Carroll Parish, and along with several follow-up meetings that will help these rural areas gain access to health care that our citizens deserve. As a result of these outreach efforts, there were MOAs signed in Morehouse Parish with Morehouse Community Medical Center and Tensall Parish with the Tensall Community Health Center. The Northeast Delta HSA continues to explore and build similar relationships, and just yesterday, the MOA between University Healthcare Conway and Northeast Delta HSA to collaboratively serve citizens in Ouachita Parish and the 12 parishes of Northeast Louisiana was signed. This is a large step forward in providing for the health and well-being of our rural citizens, and will help to facilitate continuity of care between both of those two partners. These MOAs will help to increase access to quality, competent health care for our region. This has all been accomplished in a very short period of time with Dr. Sizer and his very professional staff. It demonstrates what can and should be done to successfully meet the primary and behavioral health care needs of the citizens of Northeast Louisiana. By leaving the relative safety of the silos of health care in the larger cities and seeking partnerships in those rural areas that people call home, the desired medical outcomes can be achieved and more quickly and effectively move to fruition. Thank you, Dr. Sizer and your staff, for the great beginnings. We look forward to even greater access to these services and the realization of improved healthcare outcomes that we all strive for in the Delta region. Thank you.
Well, I didn't pay them for those kind words. I think that was genuine from them, and I received them, and I shared it with our staff members who make the difference. And I also shared with those of you who are here. It is because you were willing to want to engage that we're here. It is our mutual and collective work that will make the difference for people. It is not one individual, it is not one entity, it is all of us working together to make the dream work. And as my staff knows, and I'm fond of saying, I only like to work with the willing.